I'm here to tell you some things you probably never heard before about your mouth. There are 100 trillion bacteria living inside your body. In fact, they outnumber your human cells 10 to 1. So basically, you're a walking host organism. Kind of creepy, huh? But here's some good news. Some of your best friends are germs. 85% of all that bacteria are the good kind. Only the bad bacteria produce acid, and acid is the main cause of most of the disease that affects your mouth and gums. The stuff you have to go to the dentist for that's really expensive. Not good. Because we can't see any of these acid-producing bacteria, we needed to find a tool to help us detect their presence. Because we're really smart, we figured that out. We're going to test for the gases in your breath. Research shows that bad bacteria have a gas problem. When they eat, they get flatulent, which is a nice way of saying they're passing gas in your mouth. So measuring for the presence of those bad passed gases in your mouth is a way to find out whether any of those bad bacteria are in there. Because only the bad bacteria make those gases. Those bacterial farts are really what bad breath is. So if your breath smells, you're really getting blamed for your bacteria's bad social habits. And using mouthwash to cure bad breath? That's like spraying perfume under your armpits instead of taking a shower. Because these bacteria leave these gases in your mouth like fingerprints at a crime scene, we can measure for their presence by using a fancy piece of equipment called an oral gas chromatograph.
Oral gas chromatograph.
After we look at your breath fingerprints, we examine two other bits of dental evidence: the presence of plaque and the presence of bleeding. Those three things together will tell us just how bad your bacterial problem might be. When enough of these acid-producing bacteria poop out enough acid to inflame your gums, it causes them to bleed. Now, I know most of you think that a little bleeding is normal when you brush or you floss, on the one day a month when you actually do floss. But listen, because this is a big deal. Since when is bleeding ever normal? If you rubbed your eye and it started to bleed, would you just ignore it? If you combed your hair and your scalp started to bleed, would you blow that off? Bleeding
Is never normal.
We can do an oral DNA test, like an episode of CSI for your mouth, where we can take mug shots of some of the worst bacteria that might exist in there and find out how bad your bacterial problem might be. Probiotic dentistry is exciting for us because it's something completely different. It allows us to put the focus where it belongs, on bacteria. And bacteria are what cause dental problems. We want to prevent those problems rather than focus on just fixing the damage. It's science! So come and see us. We can do amazing things for your mouth. Stay biotic, my friends.